Well, right now, let's look at the health sector. We all know the major role that regulation plays in all sectors. It is for this reason that the Health Facilities Regulatory Agency was set up. They are to license and monitor facilities that provide public and private healthcare services. But really, what have they achieved? What have they been doing at all since they were set up in 2011, or close to 2012? We'll find out with the acting registrar, Matthew Yao Treme, who joins me right here in the studio. Mr. Treme, thank you very much for coming.
Thank you for having me.
And health is one key sector, and we don't joke with health, we as the media at all. So it's good that we find out exactly what's happening. First of all, it's been, what, since 2012 you started work, I believe. It's been a number of years already. What would you say you've been doing?
Well, we've been trying to do what the mandate of the law expects us to do with respect to health regulation. The agency was actually established by Parliament on the 31st of December 2011. So let's take it 2012. 2012, yeah. So in March.
Because the year had already ended in 2011.
And then in March, the board was to be in place and for the activity to start. But unfortunately, it's been slow in starting. And I want to call that a new agency with respect to it being what we have at the moment.
Is it still at the starting point?
Oh, no, we've started. We've done some work, and I'll be telling you about that in a minute. What I wanted to say was that before this agency was set up, we had what we call the Private Hospitals and Maternity Homes Board, at Act 9, which was to regulate private facilities, as the name indicates. But then in 2011, when the law was passed, it was found expedient to have both public and private being regulated. Okay. So the numbers that I'm going to give you will take into consideration the fact that public facilities were being run by Ghana Health Service, so to speak. Okay. So all government hospitals were
not under your supervision.
The previous body.
The previous body.
But currently they are.
Currently.
Yeah.
Okay. So since when did you begin regulating private, public facilities as well?
From the expectation of the law from 2012.
From 2012. But you didn't. I mean, in reality, when did this?
We didn't, because there was some kind of an understanding that was established that because they were already in existence and the government facilities were being regulated by government from Ministry of Health and the Ghana Health Service.
But now you're regulating it,
So
right?
now we are. So we are putting in place structures to take over fully and make sure that they come under the ambit of the agency. Okay. So the numbers that I'll give you would be very low on public facilities because, as I said, they have been under the ambit of Ghana Health Service. Okay. But then we have the private facilities which have been regulated even prior to the existence of HEFRA. Okay. And these private facilities, as you can know, are the ones that, at the time, there was concern about the fact that nobody was really in charge.
Okay. Yeah. So give us the figures already, and let's have a look at it.
I mean, the figures, I was appointed in 2017 in March. So when I was appointed, we had 466 facilities that have been
466
facilities.
Private or both
mainly,
private?
no, let's say private, because this is mainly 6 facilities that have been licensed provisionally, because the Act talks about provisional license and long-term license. The provisional license lasts for 6 months, which I, as a registrar, would be able to sign up for. But then we have the long-term one, which goes to 3 years. And so the time I took over, because there was no board in place, so to speak, they couldn't give any long-term licenses, so they were provisional. But since I took over in March 2017, to date we have 1,466 that have been licensed.
1,466. We'll go a bit more into the figures, but I'd like for you to break it down to my viewers and explain to us what exactly are you regulating? What kind of regulations are we looking at? What exactly is your business?
Yeah. All right. So the Health Facility Regulatory Agency was set up to regulate all health facilities. And when we talk about health facilities, we're talking about hospitals, clinics, pharmacies, chemical shops, which is called over-the-counter medicine sellers shops. We're talking about labs, we're talking about maternity homes. And this list can be found in the Act, where we call the first schedule, that lists all the facilities that should be regulated by my agency. And then in addition to that, there's a kind of a catch-all phrase which says that any other health facility that the minister would deem necessary to regulate.
So in your work as a regulator, what exactly are you looking out for in these organizations, and what do you do when you find out? Let's start with what exactly you look out for, so we can then later talk about what you do when you don't find what you're looking for.
All right. Well, the act or the law put some requirements. We call them the basic minimum requirements of any health facility. And these basic minimum requirements go from having a fire certificate or an environmental protection agency certificate, and making sure that the health professionals who are working there are competently qualified, and making sure that they are in good standing with their professional bodies, making sure that the equipment that is being used at the facility are the equipment that are expected to be used. So all these requirements are there. So we have the general requirements and we have the specific requirements, which will differ from facility to facility. So what we want to see in a maternity home may not be the same as what we want to see in a hospital.
But generally, you're regulating standards in these hospitals, so in these clinics, but depending on the size, I guess what you look out for is different. So what
not depending on the size, depending on the type of facility.
On the type,
because you can have some small hospitals and big hospitals.
Right.
So whether it's a big hospital or a small hospital,
it's a type.
What we need to find in a hospital should exist.
Okay, so what have you found? What have you found so far?
Well, when we do regulate, as I said, we do regulate the fact that it's a health facility and they meet certain basic minimum requirements. Okay, when we do the paperwork by checking to see that all these things are in place, we go and do an inspection. And in the inspection, if we are happy with what we find, we give them a license, either provisionally if it's a new facility, or long-term license if it's kind of an existing facility. All right. Now, what do we find? What we find is the fact that they are doing what they say they are doing. So if it's a pharmacy, we want to see that they're doing what the pharmacy does.
Okay, but
if it's a maternity,
because we've had some kind of understanding about your work, I'd like for us to focus on what you have found, because if you are monitoring all of these organizations and it's really lifted from 466 to over 1,000 since you took over. So what can you say you can report as far as the state of hospitals or health facilities in Ghana is concerned? What can you report? What have you found?
I would say, in the main, those that we've seen so far meet the basic minimum requirements.
All 1,466.
Of course, if they don't, they won't get license. So those one have, but there are others that are under registration on different stages of the process. But what I'm saying is that in the main, they meet the basic minimum requirements. Obviously, there will be others that wouldn't meet the basic minimum requirements. And when they don't, we work with them to make sure that they have those basic requirements in place before we give them the license. Right. Now, what we call the gaps that we find. So, for example, if they're supposed to have 5 nurses and they have 3, that may be a gap. If they're supposed to have some kind of equipment which is supposed to do some kind of a job in a health delivery system, then that will be a gap.
So let's talk about the gaps.
Yes.
Because I think that's where the area, now we're looking to have the best healthcare and the best of health services for our people, but the gaps will then help us to know what exactly we need to do, what organizations like you can advise the authorities to do. So what are the gaps you've identified?
Well, the gaps will be, for example, if you are a health facility, the practitioner in charge, the person who is in charge of running the facility, should be have a qualification of a minimum of 5 years. And
like
then it will be
the doctor?
A doctor. If it's a doctor or a nurse, they should have a minimum qualification of a doctor or a nurse, but then they should have post-qualification experience of 5 years. And then in addition to that, they need to be in good standing. So sometimes we go to certain smaller facilities or private facilities where they may have the practitioner in charge who hasn't got that. Now, we need to work with them to make sure that they have what it is that we need in terms of that qualification. Now, if they don't, then we may have to make some arrangement for them to have somebody who is qualified to do that.
Would you usually bring sanctions before you try and deal with the problem, or yours is to just make sure that they are adhering to best practices, so you just help them to get on with the best practices and no sanctions apply? Well,
we don't have sanctions as such, because what we do rather is to work with them to make sure that they meet the basic minimum requirements. Currently, we are putting before Parliament structures that will enable us to charge or have some penalties in place if certain things are not done. As we have
so at the moment, if you find out that a health facility doesn't meet the requirements, it's like like caution and move on.
No. It depends on what requirements they are not meeting. If the requirements that they are not meeting are requirements that we find to be critical, obviously they will not be allowed to operate. Okay. So if you are talking about sanctions, that may be the situation. Okay. There have been facilities that we've seen and we said, look, we are not up to it. You need to do X, Y, Z before we can allow you to operate. So that will be a sanction to tell them you can't operate or stop operating, put these things in place in a certain period of time, and then when that is put in place, we allow you to go ahead.
I know that I'd like for us to speak about Korle-Bu, so we wrap up this conversation. I know Korle-Bu is, I mean, as key a hospital as it is, we know that it also has so many problems.
Yes.
Have you reviewed Korle-Bu Teaching Hospital?
We are in the process of reviewing Korle-Bu. As you said, Korle-Bu is kind of a big hospital with many departments.
And many problems.
Many problems. I mean, I think our health sector, like any other sector of the economy of the country, have got problems. So health sector is not any exception.
Well, let's specifically deal with Korle-Bu. Yeah. You said you're working there now?
We are working there because currently where we are, you see, as I told you, it's a process. We have not gone to inspect to see exactly what was on the ground. But what we are doing now is the gathering of information, the registration process, where they bring us the services that they provide, the equipment that they use,
the personnel. Wouldn't you have started with them rather? I mean, being the premier
well, we don't really decide who should be started with, because the law says that every health facility in the country.
So you decide because you are running the affairs?
No, I mean, they are to come and register, and then we will go and inspect and give them a license. So what I'm saying is that we are not saying Korle-Bu should come first and Leicester should come second. No, okay. All of them should come. Okay, now some of them have not come, and I'm telling you, in the case of Korle-Bu, we are in the process of gathering data. So when we have got the data, now we'll move into the next stage of going to inspect. And I'm sure when we go and inspect, we'll find the gaps.
Did you ever inspect the Obinfo clinic, for example? Does it?
No, not at the moment. We've not inspected Obinfo. Obinfo has started the process. Okay. Is gathering information. And when we are satisfied that we have got all it takes in terms of meeting the requirements, the next step will be to go and inspect.
I mean,
he has not met the requirements yet.
The story about Obinfo came up, I mean, it's been running for some time now, yes. Especially here on our medium. And since you've been working for, well, you started in 2017.
Yes.
Did it ever come to your attention that people had raised concerns about this hospital and that you wanted to go in there and find out what standards they're working with?
Yes, I mean, there was an issue with Medical and Dental Council, and that was brought to my attention when I took over, that there was a problem with Obinfo Hospital. And then during my tenure, there was a death of Stacy. That also drew attention of the public to what was happening. We have been to Obinfo just to ascertain whether it was open or it was closed. The time that we went there, it was closed. But we have it on authority, and in fact, he has confirmed himself that he is operating, even though he is doing so without a license from HEFRA. So Obinfo's situation is that he has started the process. He needs to meet certain basic minimum requirements. Then we move on to the inspection. So
at the time you went, okay, so I thought you had already inspected. So no, at the moment, based on what you have,
yes,
does he qualify to be, does the hospital clinic qualify to be in existence?
I mean, I would say yes, except for the fact that we have a problem with the practitioner in charge. Okay? A practitioner in charge, as I said, should be somebody who is qualified and has a 5-year post-qualification experience and is in good standing with the professional body that the person belongs to.
So if it's a nurse, himself,
does not have the good standing status of Medical and Dental Council. So he cannot be a practitioner there or a practitioner in charge, so to speak. That is where we are. He is supposed to bring us somebody who is in good standing with the Medical and Dental Council. If he does that, there's no reason why he would not be licensed and he will not be allowed to operate. He may be the owner of the facility, but not as a practitioner. As a practitioner, the law is very emphatic that you should be in good standing with your professional body.
Oh, well, that's interesting. There are also a lot of tiny, if you like, quack health facilities. What's your plan for it? Have you looked into, is this an area you've looked into? What did you find?
Yeah, I mean, as I said at the beginning, the definition of a health facility, anything that provides health for the people, whether treatment or diagnosis or whatever, we are interested and we do. So whether it's big or small and it's a health facility and providing health services to people, we need to ensure that they meet the basic minimum requirements. So yes, we are interested in all the labs. Now, when they register and we go to inspect, we want to make sure that certain things are in place. And if they are not in place, we tell them not to operate. Okay.
So is it always that you wait for them to come to you? Can you just move in?
We do. In fact, we do. We have had, last year, for example, we had national service personnel, about 66 of them, going around the whole country, visiting facilities. In fact, we were able to identify 16,054 facilities. Okay, and some of them were with us, some of them were not yet with us, and we are working with them, and we have a department in our agency whose job is to make sure that these facilities do what they're supposed to do. Now, if they don't do what they're supposed to do, then we move in to do what we need to do. That
looks and sounds like a lot of work for me. So what's the resource base? What kind of support do you have in terms of resource, your human resource, financial, etc., to carry out this mandate and to be effective at it?
Well, the unfortunate thing is that I don't know what happened before I came into the scene.
Oh, you should know.
In 2017. But what I know, I can talk about what I came to inherit.
Okay.
I came to inherit an agency that was kind of stuck away in some small place under Ghana Health Service in Tema Station. For me, that was not fit for purpose. So that was the first weakness that I identified. You cannot regulate health facilities in this place. There were no place for people to sit as reception when they came to do. So that was the first place. The second thing that I realized was that the agency did not have any transport resource. There was no car. And we are supposed to register, inspect, and the whole country, not even just in Accra. Okay. So we didn't have that.
So at the moment you are looking at setting up properly.
Yes, of course. So that has been what we've been doing first since I've taken over.
That has taken all your attention.
Yeah, trying to make sure that we put structures in place to get the resource that we need to be able to do the job that the law expects us to do.
How much
So for example, we didn't have staff. I inherited 9 member staff for the whole country. You can imagine. 5 of them were seconded from Ministry of Health, Ghana Health Service, and 4 of them were volunteers who had not been properly engaged.
Okay, so
as we speak now, we have 25 financially cleared people. We are waiting for others to join. And then we have 26 national service personnel. Last year I used 66 of them. This year I have 26 national service personnel, and 100 people have been allocated from NAPCO to help us do the job. So we're going to have more people to help us do the job.
How much was allocated to your office to be inspecting these health facilities and clearing them? There has to be some budget. How much?
Well, there is budget. I mean, I will not be able to sit here and quote the figures, but I can tell you that we have about 2-point-something million to employ staff.
Okay.
I mean,
2 million just to employ staff.
Yeah, that is also.
What about moving to check these hospitals and these facilities and to make sure that they're living up to the standards?
Well, I mean, currently we have been able to have access to 3 vehicles.
Okay.
All right. The board is working to ensure that we have 10 vehicles in all the regional capitals.
So you have 1 vehicle in each region?
That is what we are hoping to do. We don't have yet. Okay. So, I mean, the other difficulty that we had is that when I took over, we were only in Tema Station in Accra. Now we have offices in Ho, in Koforidua, 2 in Kumasi, yeah? And so we are getting there. In fact, we have an extra office in Accra, Tesano. So we are getting there. Okay. We are training people to be able to do what is it that they need to do.
Okay.
We are making sure that we employ enough staff, the criticals that we work in Public Services Commission, to get the technical clearance so we can go to finance to get a financial clearance. Unfortunately, to my very disappointment, it's taking too long. I would have thought that I would have come into an agency which was well-resourced to do the...
Well, that's why we employ people. We employ people to fix the problem.
Yes.
So we've employed you to come and fix the problem.
I'm not complaining.
That's why I'm paying you.
Yeah, I'm not. Yes. Thank you very much for paying me to do that. But I'm not complaining about the fact that there are problems. I'm complaining about the fact that we are taking too long in dealing with the problem. Because health, as you know, is something that affects all of us.
It does.
It's not just a cross-section.
Which is why we've taken all this time to have this conversation, and hopefully we'll get some solution to this problem. So, but finally, let me just finally ask you about now that I get the feeling that you're set up. I mean, you're somewhere.
We are setting up.
You're setting up, but you're somewhere.
We got somewhere, better than before, much better than
where you
where
can
we
be
were
efficient.
before.
You have the people, financially clear people. You have a few vehicles. You can start the work, and when you make the impact, I'm sure that you get more. What should we expect in 2019 in terms of regulation, regulating these health facilities in whose lives most of the time
in 2019, what I'm going to tell all health facilities who will be listening to this, and the Ghanaian public, is the fact that we want to license all health facilities. They are estimated to be about 33,000. I know it's a tall order, but we are not going to say that you take your time because we are not there yet. We think we are there. We have an office in Accra, we have offices around. We are trying to open more offices. There will not be any excuse. So health facilities need to know that by law they cannot operate if they don't have a license from us. So the board has agreed to take strong action with respect to those facilities that are not doing what they're supposed to do. We are also, in fact, we set ourselves a target of 4,500 for this year. In fact, just yesterday we had a press soiree, and the board said we should aim to getting 10,000 minimum. For me, these are all minimum, because as I said at the beginning, I don't see any reason why a health facility would operate against the law in this country. So
in 2019, you're not tolerating that at all?
No.
Health facilities ought to get to HEFRA and get registered. That's the Health Facilities Regulatory Agency. They may have been silent for some time now. They say, look, we're coming after you. If you're a health facility, you're a facility providing health services for people, you need to be regulated. You need to be licensed by this organization. So they're coming after you, and you have to look sharp, if I should say. That's the conversation I'm having with Matthew Treme, who is the acting registrar for the Health Facilities Regulatory Agency. They're looking to do a lot more work by way of licensing these organizations. Thank you very much, Mr. Treme.
Thank you very much for having me. And I think you would also continue to help us propagate the message, the need for health facilities, and you become our advocates. We have a website, www.hefra.gov.gh. We have a telephone number 0302 900 995. We have different, if people go to our website, they will see how to communicate with us.
So for people who go to health facilities and they find out that standards, they're not meeting the standards, they can call you.
They can
get in touch with you.
Us. We have an email address, info@hefra.gov.gh.
Okay, so let's go through this. Info at
HEFRA.
HEFRA.
HEFRA is H, no, all small letters.
Okay.
HEFRA. .gov.gh.
Okay.
And we can show them that if we should hear from the public, and we expect the public to be advocates for us as well, because it's for all of us, as I've said.
Okay.
And if they tell us anything that they see which is untoward, they can rest assured that we would take action.
So you can send them an email at info@hefra.gov.gh, and their website as well is hefra.gov.gh. You go there, you find information as to how you can contact them. If you go to a hospital that is lacking in the standards, give them a call and they'll come to your rescue as far as that health facility is concerned. Now,